The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Welcome to this week's episode. With you, your co-host, Dr. Herb Bravo, and your co-host, Dr. George Rogu. Please help us welcome Dr. Juan Carlos Espinoza, a practicing pediatrician in Long Island. We will be talking about the intersection of Medicaid and health equity, how to maintain your vision and margins in an independent practice providing care to low-income and immigrant children.
Hi, Dr. Juan Espinoza. He's going to talk to us today about some secrets.
Now, do we call you Juan or Juan Carlos?
Oh, either way.
Either
Juan
way?
Carlos is, yeah.
Well, what does your dad call you?
Juan Carlos. Yeah.
Juan Carlos, welcome to our podcast. Thank you for being our guest
Thank
today.
you. Thank you for having me. This is great.
We always like to start the podcast by asking you about your journey in medicine and particularly why you chose to be a pediatrician.
Specifically pediatrics, I think for me is really the only, obviously I'm a little biased, but it's the only thing in medicine that actually works. It's really the preventive medicine is alive and well in pediatrics. It's actually made a huge difference in our society. And kids get better, they don't just get good enough to go home, but they actually get better so that they can grow up and thrive. So I was always attracted by that in pediatrics rotations compared to, all the other rotations. It attracted me the most.
I guess having a father that's a pediatrician forms some of that bias.
At first, so he was an endocrinologist at the time, and at first, because of that, it was actually it was a bit of a deterrent because it just didn't like the hours, didn't like the all the other stuff, and then but it just clicked. It was just one of those things. You're in that rotation, you say, hey, I think this is what I want to do. So.
And why did you choose private practice as opposed to academic practice or management? Well,
at first, when I finished my training, I actually stayed on the hospital, on staff. And I really liked the academic part of it. I really enjoyed the teaching. And I just couldn't get through the employment part. I think that for me, I wanted to make sure that I could do the work in a way that the job didn't get in the way. And for me, the job in sort of as an employed physician was just getting in the way of doing the work the way I wanted to do it. So there was all these layers of administrators and all these rules about who you could reward and which employees you can't get rid of, and all these other things that just didn't have anything to do with or not so much didn't have anything to do with medicine, but it just got in the way of me doing my job and took away my ability to control my environment. But at the same time, I was completely responsible for all of it.
So you wanted to innovate and be nimble, and within a big organization, that's often very difficult.
Well, of course, but also I think I didn't like the fact that I was accountable for everything that happened, but I had no authority to make any changes in the workflows and in the way that patients are being seen. It was just a lot of it was just you just see the patients and keep quiet and we'll take care of the rest, and that just didn't sit well with me. So I started looking for this other option. And as George mentioned, my father had a private practice with another physician in Brentwood, and so I worked part-time at the university hospital, and then covered some of their days off, and I kind of started into doing that.
Cool.
And tell us about your life and daily routine in your practice?
Well, these days is a bit different than when I started. Most people know that when I started, it was, six days a week, and going to the hospital on Sundays and things like that. These days, I don't go to the hospital anymore. I'm sort of the senior partner, so I work 4 days a week. We do 10-hour shifts. 8 hours is patient contact, and then the other 2 hours is charting and administrative stuff. So yeah, just go in and I see the patients. If I have administrative things to take care of, I set time aside for those. But you know, um, I look forward to going in to see the kids. I look and see who's on the schedule. I've been doing this for 20 years, so I recognize a lot of the names, and just sometimes I go, gosh, Jimmy's 18 already. I can't believe it. That kind of thing.
Yeah.
But it's a pretty routine day. Nothing special.
Do you speak a lot of Spanish in the office?
Yeah, most of our patients themselves speak English, if not all of them. But a lot of the parents, even though some of them speak English as well, a lot of them prefer Spanish, and it's more of a cultural thing, not just a language issue. I think that's been something that we saw early on, that we could provide uh, the kind of care that we wanted to provide, but not just technically in terms of medicine, but also in the culturally sensitive and way in the community that we are.
Great. And what works really well in your practice?
Well, I have to say, there's a few things that I'm very, very proud of, and I really think that are probably the secret why things work. Our practice does well. Number one is the relationship between the partners is not a dysfunctional relationship, as I've seen in other practices. So we trust each other. We split up the duties of what it takes to run the practice and supervise. We also delegate well, and I think that's another thing that we are not taught to do very well as physicians. Everything is your responsibility, so therefore you should do everything yourself.
I
And
think
that
the,
is just such a terrible way of running a business.
I think the trust thing between the partners is like key to the success of a partnership, because I've seen
Absolutely.
so many practices where they keep like a running tally of how much I made, how much you made, how much I
Yeah,
spent,
how many
how much
patients you
spent,
saw.
who's ahead
Yeah.
on this. I don't have to buy so many vaccines because I have a lot of VFCs, or I saw 50 patients more than you did, so I should get
Right.
$50 more than you did. I mean, it's too much energy to figure that out.
Yeah.
I've been running reports to see the overall productivity of the partners over the years. You know what? They're plus or minus 10, 20,000 a year. It's the same at the end of the day. And the
Right.
numbers of patients that you see are relatively close.
And I think that part of the issue there is because a lot of people still don't get out of the idea that the only way to bring in revenue to the practice is to see patients. There are ways of doing that differently, like these quality incentives and all these other things that don't require you to see the patients, but require your time and your efforts in other parts of your practice. So for
So,
sure, I think a good working relationship, based in trust with your partners, is probably the number one thing.
Right.
Delegating, number two. We have support staff, care coordinators, practice administrator that takes care of the quality measures, the chasing of those numbers, and the counting the beans, and then of course a good billing department. Those things work really well when they work together, and we make an effort to make sure that they're working together. So
Right.
at the end of the day, we're not the ones, staying late and going over the HICPA forms and doing all these crazy things that other practices do. We
Right.
just supervise, and we kind of bring the the overall feeling of what it should be, how things should work.
Right.
Works well.
And so how did you get into outreach and quality measure tracking?
Well, frankly, the issue was in the population that we serve. Long Island is pretty segregated, unfortunately, and the population where our practice started, it was a working poor, lots of immigrants, lots of just Medicaid patients, and people who didn't have money to pay for things. So Medicaid was and continues to be sort of the lower reimbursement, the lower rate. And so we had to figure out, well, how do we, number one, we decided, look, poor people and people of color and immigrants and those people deserve good doctors too. We want to provide that service in a way that's different from the health centers that traditionally had taken care of these patients. We saw the deficiency that the health centers were having, because we were seeing their patients. The patients that they couldn't see would show up at our office and be willing to pay cash. So we figured, look, we got to do this better than they do it. And we have the same population of patients and they pay us the same. So how do we figure that out? And once, we would have meetings with the insurance companies, and they would tell us about these quality incentive programs. And then we started working those and seeing that it's actually good medicine. It's a high percentage of vaccination rates. Make sure that they have their well visits in time, make sure that they do their screenings in time. So it was kind of deferred payment, right? Which is really what it is. It's not really a bonus, as they call it. It's actually just deferred payment. I'm going to pay you in a year and a half for what you did, what you already did. But it was really a way for the practice to survive and to actually stay profitable in the environment that it was.
So I'm just guessing. You started measuring the percentage of vaccines, whatever, HPV or that, and you had a goal. So if your practice was doing 80%, you wanted to get it to 95%, and then you would get additional payments from the insurance company.
Right. I think the biggest change was we started looking at ourselves, right? And that's something that doctors never did before, or if they did, it was very, very rare. We started looking at our own data. How are we performing? For forever you would say, well, I think our patients, 90% of our kids are fully vaccinated. And then you look at your data and you're like, 65%. Whoa, and then you start looking at that and start saying, well, how do I make this better, right? How do I figure this out without spending more money, without hiring more people, without, how do I work smarter toward this goal, and keep the standards high, keep that initial promise, poor people deserve good doctors too.
So you're telling me the first thing is to measure, because what doesn't get measured doesn't improve.
Right.
Yeah, absolutely.
And with an ECW, I find it very difficult to run reports to find measures. How did you breach that gap?
Well, you got to remember that, we started doing this about 20 years ago. So it was way before ECW and the other stuff. We were just doing this stuff by hand. We were running these, even NICEs wasn't really as functional as it is now. So a lot of this stuff we just did by hand. We would just get the list of patients and make a spreadsheet and who's got a HIV, who's got a Prevnar, who got et cetera, et cetera. Eventually with ECW, again, what we did is we delegated someone to go and take the class and learn how to run reports on ECW and get them. And again, it became a little bit better, a little easier, but it's still sort of fractured. And it wasn't until now that we're able to work with the HITS people to try and put together this dashboard that we're seeing a bigger picture.
And so you wanted to do outreach. 20 years ago, the outreach was pick up the phone and call.
Right.
you haven't really adopted texting or WhatsApp to your population to try to encourage them to come in
But
for the
right now
wells.
we do texting through ECW,
Okay.
and there's direct messaging through ECW and email for appointments. The outreach stuff we also do initially by text, but you have to adapt to the population you're in. Not everyone is device savvy, and we have to try and figure out a way to so we do still do a lot of phone calls.
A lot of phone calls.
Okay.
And what I find interesting, Juan, you mentioned earlier that your practice did it different than the health centers. What was it that you figured out was different compared to the health centers? What did you do? What did you do better?
I mean, I have to say, I never went to a health center to see what they were doing wrong.
Well, you
It's
remember
just that what they were doing well. I just basically I assumed that what patients would say is that they just couldn't get there. They couldn't get in. They couldn't see the doctor. They couldn't, they had to go through like 4 or 5 different people before they got seen by the doctor. So we were just being more efficient in terms of doing the same amount of work in a shorter period of time,
Right,
without requiring the patient to go through all the steps. In other words, I think that what we saw from what we heard from the patients was that, when they came in, there was a process that they actually had to walk through. And what we figured out is, well, why can't they walk through 4 processes at the same time, so that, they can be registering and filling out a form and getting the vitals sort of at the same time, instead of having to wait through, the entire traffic before they got to us. And why don't we do that? Why don't we, the physicians, do some of that work as well? Because some of it was relevant to the follow-up, some of it was relevant to the diagnosis, and so, figuring out how to, writing just little things like, writing a school note, and, writing out referrals for labs, and we would actually send them out of the room with a stack full of papers that was already done. And all the checkout people had to do is make copies and send them out, and eventually scan them and send them out. But, there were a lot of things that we were doing that just made things quicker. We were in the room already. It actually gave us a little bit more face time with them, to be able, just checking boxes and doing things like that. And the patients liked it, because we weren't just coming in, doing the exam, telling them, giving a prescription and leaving. And then, we actually went through the instructions and doing all the other stuff ourselves.
So you look for opportunities to eliminate funnels where,
Right.
you go down this thing and everybody else has to wait.
Right.
Look at opportunities or wins in efficiency.
Right.
So, efficiency of all kinds of process.
Right. And, efficiency was something that we defined early on as doing all this stuff that they want us to do in the same amount of time. So not quicker. I think that a lot of people confuse being efficient with being quick. We don't do quick medicine. We don't think it's safe. We don't think it's appropriate. And, we just don't do it. That's not what we want to do. So, and we don't do convenient, convenience, like I can't make your ear infection convenient. I can't make your asthma attack convenient. You know what I mean? So yeah,
Yes.
you're going to wait, and it's going to be a little inconvenient. You might have to take the day off of work or a couple of hours. So I think that early on we established the type of consumer product we were going to make. It wasn't going to be this quick, convenient thing. You were going to get good medicine, and we were going to do it as efficiently as possible, so that we could check all the boxes. But it wasn't going to be this kind of quick in and out, convenient experience for you, because we don't have customers. I tell people all the time, we don't have customers, we have patients.
So you were more focused on being effective, having
Exactly.
an impact,
Right.
and being
Exactly.
efficient, but removing any roadblocks or barriers or pain
Right.
points that could have impeded your ability to be effective as a pediatrician in particular.
Right. Right.
Yeah, that's an awesome philosophy to have. So, how do you manage all these long hours and on call with the family and friends and parents?
I think that unfortunately it just comes with the job, but I to tell you the truth, my degree shouldn't have just one name on it. Right. It's the question is, how do I manage the family time? You know, my family manages, the people that love me manage, and they help me manage it. That's really what it comes down to. And that's what it came down to, So when it was time for when my children were young and there was soccer games and there were things like that, there was a lot of, splitting up of uh, um, um, responsibilities and lots of running around, but you just do it because again, it's a very functional thing, right? So if you have a functional partnership at work and you have a functional partnership at home, then things work. But I'm not going to take credit for all of it or even any of it. It's
Yeah.
just very
So
lucky.
So
That
we hear,
soccer little league thing is a new thing because I hear this a lot. Well, I can't work on Saturday because I have to take my kid to soccer or little league.
Yeah.
I remember I didn't go to every single soccer game, but I went to like 80% of them. That's pretty good. I wasn't an absentee father. I was there a good portion of the time, 80 to 90% of the time.
I agree. I think that we think our children need us more than they actually need us.
Right.
Uh, I think that they're actually pretty good and they're pretty strong and they're pretty smart and they're a lot better than we are about a lot of it. I think that for me, it was more, quality time and how do I make it count when I'm there.
Right.
I'm not saying I was successful every time. And like I said, I'm not going to take any credit for any of it, but you know, they made it work as well. They made it work.
So we hear this over and over again in the very successful pediatricians that we interview for the podcast. And I hear it also in thought leaders outside of pediatrics in the healthcare and healthcare technology area. For success, other than the vision that you have, which is to have a great impact in the exam room, we need great relationships with our partners, great relationships with our spouses, great relationships with our community. And if you lose a relationship, you lose a conversation, you struggle providing the mission and the vision that you have for your business.
Absolutely. But you know what? Most importantly, I think um, when it comes to the practice and the effectiveness of what you do is a good relationship with your patients. I think that you can waste a lot of time if you don't spend time with your patients, listening and trying to see exactly what it is that they want to leave your office with. Um, you know, uh, um, if you take the time to explain to some, look, if they've been waiting 45 minutes, an hour to see you, and then you take the time to explain to them why their kid is coughing more at night than during the day and why it's taking so long for them to get better. And I draw little pictures of this and I do this and they forget about the fact that they were waiting a long time. But they go home with a kid that is not a time bomb and they know and they understand that I really want them to understand what's happening with them. And they're not calling me 3-4 times that week after that visit because they know what's going on. So I think that making those really important relationships, realizing that you can educate your patients without putting them through med school, but you can do that in a short period of time if you kind of move all the other things aside that are necessary, all the boxes that need to be checked, all the administrative stuff, move it out of the way so that you can still spend that time and educate your patients. It's going to save you time later. And it's going to make things more, efficacious and efficient because you just got a lot done in 10, 15 minutes.
Right.
and those patients are not going to go to the emergency room. They're not going to call you at 11 a.m., 11 p.m. They're not going to, et cetera, et cetera. Those patients are going to, and they're going to trust you. At some point, they're just going to have to trust you. And that's the idea,
So I'm going to ask this question because we were going to ask it, but I think you really enjoy working as a Spanish-speaking pediatrician in a Spanish-speaking neighborhood, and you have found a way of making that profitable despite the low reimbursement rates of Medicaid. Would that summarize it?
Yes, I absolutely enjoy it. I think it's one of the most rewarding parts about our practice, that we're able to provide the care for, and look, I went to high school in Brentwood. That's where our practice is. I went to, a lot of these kids that, I want them to see themselves in me and in the other providers. That's a huge thing for me.
Yeah.
He's
Yeah.
a role model.
You're
He's a role
definitely
model, this guy.
a role model and a leader, right? Is someone worth emulating.
Yeah.
And tell me a little bit about the managed Medicaid line of business. Like we kind of touched, but that had to be a little bit challenging at the beginning. But is it still challenging, or have you got the dashboard there and now you're kind of like coasting?
Well, no. I think it's always going to be challenging, right? Because it's not only the lowest reimbursement, but there's also the quickest moving target, right? They're always changing the rules so that they can sort of keep more of the money from the state, and then they the reimbursements don't necessarily go up. It's very difficult to negotiate with them. They always give you the whole, well, we're not getting any money from the state, so we're not going to send it to you, etc. There's a lot of
quality.
So challenging for sure, but I think that's part of the enjoyment, right? Just kind of taking on the challenge and figuring out a way to do it, to still do it well, despite the challenges.
I think if you do good quality and you prove it to them, they're more likely to listen to you than if you're on
Oh, for sure.
paper.
I mean, all these years, yeah, absolutely, George. All these years where when I've sat at the table, to negotiate with them, the thing that I bring with me every time is the quality performance. And I ask them, who else is doing this?
Yeah.
Who else is doing this? And but it is difficult, because frankly, the patient population doesn't have the advocacy that other populations may have. And so, they have a little bit more of leeway as to what they can do with the providers.
Yeah. Remember that that value-based contract that we sat together on?
Mm-hmm.
We tried to explain to them good quality with the community and the neighborhood. Remember what they said to us about pediatrics?
Yeah, right. They said, look, I think it went something along the lines, well, like, our budget is about whatever, our expense is about $2 billion. You guys have less than 1% of that. So you guys are lucky that we're on the phone with you. Like, okay.
Yeah, great mission, right?
Yeah.
The future of America depends on these kids being
But
healthy.
we were successful
Yeah.
by proving quality, right?
Right.
And they wanted to learn from pediatricians because, like you said earlier, pediatricians do it right.
Yeah. I mean, it works. Pediatric. How many kids with polio do you know?
Right.
Really. I mean, it's we through pediatrics, a lot of terrible diseases can be eradicated. We're actually working for the next generation. That's what it's all about. For every animal on Earth, including humans. And it's nice to be in that, in that part of that effort, right? That we are making the next generation healthier,
right?
Or at
and
least
it's selfish.
healthy.
It's selfish, right? Because as we grow older, we're going to need this younger generations to be able to care for us, in a compassionate and efficacious and impactful way. Because we're all going to grow old and get sick at some point.
Exactly.
So this is teachings with Dr. Roga's dad, and it seems to me that you learned this lesson early in life. If you do good medicine, the money will follow.
Absolutely. It was actually one of the best advices I got when I was trying to figure out what to do. I did a rotation with a brilliant pediatric endocrinologist at Winthrop University Hospital at the time, and he said, you should do what you love to do, and if you love to do it, you're going to do it well, and if you do it well, people will notice. You can't fool people. You can't convince people that you know what you're doing. You just do it, and people notice that and then the money will come. Don't worry about it. If you do something well, you'll be fine. You don't have to worry about you won't have to worry about making money. You'll be fine.
That's right.
And now what I'm seeing happening in the medical world is they're all following the money, and nobody's doing good quality anymore because they're just following the money.
Well, I think part of it is because everybody's being employed. And so when the only thing that you have to get out of your training is a good job, right? Then, so then you look at, so what is this job going to do for me, right? Am I going to get good benefits, a good salary, et cetera, et cetera? And I just fear that a lot of the residents that are being trained are not being exposed to community physicians and private practices, that they don't see that you could actually, so there's a lot of us actually have a mission, which it's not just a business, it's just the business is a way of achieving that mission, right? Like the mission that I picked was, I want to practice in an area where there's a lot of, poor people and immigrants. And I want to make sure that I bring what I've just learned to that community in a better way that it's being brought by the health centers, which is what those communities were being served by, right? Because even the pediatricians that were there, they didn't take Medicaid patients. I met with a pediatrician way back then, who said, well, we don't take Medicaid patients because we don't want those people in our waiting room. It's just like, so little things like that just people just missed. And it's just, so for me, this is not just a way of making money, or not just a career. This is a way of achieving that mission,
So I had a similar experience as yours. A very successful pediatrician told me, we don't take Medicaid because the moms of our kids won't appreciate to be sitting in the same rooms with the people that cut their grass or clean their houses.
Right.
I can understand when you can't make ends meet because Medicaid pays you so little that you just can't do it. But whoever sits in the buzz, it really doesn't matter as long as they're willing to pay me to take care of them.
Exactly.
Because I'm not Bill Gates, so I can't go out in the world and open pediatric practices and not make money. It seems to me that you don't not only enjoy, but you really love what you're doing. You're passionate. You feel like you've made a difference, and the EHR and the quality measures and the jumping through hoops no longer bother you because you feel like you're really making an impact in your community every day. Am I right in that?
Yes, I would say yes. Yeah. All this, one of the, I think being independent has given me the ability to work around all those obstacles to continue to do the work that I want to do, to make sure that the job doesn't get in the way of the work,
Yeah.
And I don't know that I would be able to do that if I was just employed and I had to deal with, some soup, figuring out how to work my office,
Right. And we've already talked a little about your key drivers of success. Try to summarize them. First is you got to be passionate about your mission. 2, you got to put quality in front of everything. Those two things don't happen unless you build the relationships.
Right.
Any other takeaways that I missed?
I don't know. I'm still trying to figure out. I guess stay humble. Stay teachable. I think that you could learn from a lot of people that may not necessarily be physicians. You know, the prospect of learning medicine is so daunting, right? There's so much to learn, and it's, you know, in the beginning you concentrate on making sure that you stay up to date, and then, you know, once you make a habit of that, then you have to start figuring out, you know, how to learn other things that will allow you to do your work. So, you know, just learning from colleagues, but not necessarily, you know, what do you do for kids with ear infections? But, you know, how do you take care of this problem in your office? Who do you use for HR? You know, George and I have been exchanging information about best practices, about how to do administrative things. You know, the idea of the call center was something that we kind of threw around for a while, and then he went and did it first. And once he did it and it worked, then I did it. And then he made it very, very easy for me to kind of make that transition, because he had already gone through the experiments. You know, he came by my office and kind of walked around with me and said, hey, you know, this is you know, what's your workflow like, et cetera. These things, I think that there has to be a certain humility for you to reach out to a colleague, or to, you know, an IT professional, or anybody, you know, just to say, hey, can you teach me something?
Yes.
I need to solve this problem. How do I solve it? You know, and I think that humility is something that a lot of physicians unfortunately lose. And I think it's something that we really need, especially in this environment, because it's the only way that you can make a neighborhood, or you could turn this sort of marketplace that they've turned us into, and turn it into a neighborhood of you know, providers and physicians and private practices.
Right.
So I'm very humbled by you, and you're an extremely likable and successful human being.
It's very nice of you to say.
It is.
I have one more thing to add. Number 5, you should, and you do this, you should adapt to the times and pivot on demand.
Yeah.
That's
Stay flexible. Yeah.
Stay flexible, because a lot of practices, hey, we've always done it like this for 50 years, so why should I change? I think
Yes.
that's the
It's
worst.
the worst
that
thing. Yeah.
happens,
So,
you know?
so the two of you point out to a lesson I learned while I was in medical school in Costa Rica. One of my mentors was a pediatric infectious disease specialist. She said to me, only 2 things matter, Herb. As long as your head's still attached to your shoulders, there's a tomorrow.
Yeah.
And the second thing is, you will never fail because you read every day. Never stop learning.
Yep.
You stop being a good pediatrician, you stop being a good business partner, you stop being good at anything in life the day you lose curiosity. And you have repeated those things today.
Oh yeah.
And that was very early in my career. This was a very beautiful lesson that you taught me, more than all the pediatric infectious disease that anyone else could have taught me. And you're saying those words again today. So thank you for that.
Yeah.
I want to ask you just a couple of negative questions.
Okay.
What do you think are the barriers for pediatrics as as an independent practice right now?
Let's see. Is this already the second chapter, the second program?
It's another podcast.
Just 1 or 2 things that you see that are barriers towards collective success.
Yeah.
As
So
a community.
I really think that in general, unfortunately, I really don't think that society values children's health as much as they say they do. Number one, because they were actually one of the lowest reimbursed specialties, and it really is a specialty, right? Even though it's primary care, but it is, we specialize in children, and they're not little adults, as many people in medicine think. And so I think that until society, and the the United States society specifically, You know, I was born in El Salvador, and I visit sometimes, and actually the physicians who do the best in terms of reimbursements are pediatricians there. You know, like the top of the class are, they go into pediatrics residency is very competitive, because they value children differently than we value them. So that's one thing. So it's hard to continuously get paid less and to see that than other people for doing good work. And it's hard to get a seat at the table when, you know, when it's not considered an important part of healthcare in general. It's not given the same weight as other things that are more kind of, you know, repairs than prevention.
But we're working to change that now.
Oh, absolutely. I think that's kind of what the reason why we had put this thing together is because we, you know, we need to have a voice. We need to show people like this, you know, this is what you need to invest on. It is not because we want to get rich, it's because we want to make it easier for children to get good care. And I think that the low reimbursement is for sure a barrier. And you know, you very graciously, you know, refer to me as a success story, right? But there's a bunch of other stories, a lot of other people that have been deterred from going into these populations and providing care for high percentage Medicaid communities because of that. And that is a barrier. That's a barrier that's created by you know, government and society and the people who decide. So I think that's probably the biggest barrier.
So we need to advocate more. And part of the mission of the podcast is to highlight successful people, pediatricians, or
Legends.
independent legends who have done
Legends
it.
like Dr. Espinoza,
Oh,
Yes.
wow.
the legend of
Take it easy, Joe.
But I want to know if there's someone in particular that you admire that you want to share with our audience.
Oh, there's so many people. So many people. I think, you know, in terms of
Just one, whatever pops to the top of your mind, your dad.
Yeah, I mean, my dad, obviously, you know, because he, you know, for all the reasons, but I think one of the things that I admire, the many things that I admire about my father is that he was a great physician. He was really a true physician. He, you know, of course, he trained, you know, you know, he trained in the, you know, the 60s and 70s. And, you know, this is before CAT scans and echoes and things like that were available. And so his, you know, his clinical skills were incredible. And his, and I think that the idea that, you know, you have to spend time with the patients, you have to get the diagnosis, you have to do a full exam on every patient, made it so that the philosophy of the practice was, let's get all this stuff out of the way and make sure that we have space for that with every single patient. You know, he would say, like, you know, if the child's here for an earache, you're going to do a full exam. You know, check their bellies. You know, check their femoral pulses. You know, listen to their heart. It's going to take you 2 minutes. You know, little things like that. Like, really, the value and the privilege of being a physician, I learned from him. You know, it's one of the things that I've learned from him. And it's not the only thing that I admire about him, but it was really, for me, it was a privilege for all those years that we worked together to be with him. You know, it's just like having like your favorite professor at the bedside all the time. You know what I mean?
Yes,
It's just like everybody's had those rotations. Are like, oh man, you know, this is what a privilege. I can't believe my rotation's already
That's
over.
right.
So for me, that was great, you know, to be able to do that.
Now, what are you reading now? Anything fun?
I'm actually reading, I just started reading this, and I forget her name. It's a book by this psychologist. It's called How to Decide. And it's very interesting. It's a bit, instructional, but it really kind of puts things concretely about how people make decisions, and it's biases about decisions and why we consider good decisions or bad decisions, et cetera. It's interesting. But nothing really special. I have to brush up for it because I have to renew my boards pretty soon, so that's taking up a lot of my time.
Well, I really want to thank you. It's been an
Thank
emotional
you,
and
Dr. Espinoza, the legend of Brentwood.
an wonderful time spent with you.
Thank you.
I hope we get to do it again.
Thank you. Yeah, I really appreciate this opportunity, and I think this is a wonderful venue for us to get back to having conversations with each other. Now that that has somewhat disappeared, I'm very, very happy that you are providing that for a lot of us.
Yeah.
And thank you for the invitation. It's been
Well,
wonderful.
this is called the Pediatric Lounge. You'll find it on Apple, on Amazon, wherever you get your podcast. We also have a YouTube channel, thepediatriclounge.com. It's everywhere. So if you know of anybody that you would recommend, another great physician, another legend, share that information with us. We'll talk to them too.
Will do. I think this is wonderful. It's a wonderful venue. So
All right.
Thank you.
I'll be listening. Thank you.
Thank you.
Thanks, Dr. Espinoza.